Hello, my name is Paul Casey. I'm the Chief Medical Officer here at Rush, and I just wanted to take a minute to address a few common questions that have come up about this coronavirus or COVID-19 outbreak. So, start just with a general overview of coronavirus. So, coronavirus is really the cause of many common colds. What's a little different about this novel coronavirus is it's a common cold to which a lot of us have not been exposed across the world, and that's why you're hearing about a lot of people getting sick with symptoms of coronavirus. So when our immune system hasn't been exposed to this before, it can cause symptoms. It causes us to get, in this case, the most common symptoms are upper respiratory symptoms. So same as a cold, fever, cough, congestion you might experience as well. And about 1 in 5 patients also develop some diarrhea with the coronavirus. Now, the great news is that the coronavirus is actually quite mild for the vast majority of people that get it. About over 95% of people that get the coronavirus will just have a cold and nothing more than really a cold. There are certain groups that we worry about that are a little more at risk for developing more severe symptoms, and that's specifically those that are over 60 years old, those that have some other diseases, so those that are over 60 with diabetes, with high blood pressure, with heart disease. That tends to be the group that is more likely to get sick from the coronavirus. But again, for the vast majority of people that we see with coronavirus, going to feel like a cold. Even those that are seen here in the hospital would be discharged home for what we call home quarantine, or to stay in their room, stay in their house so that they're not spreading this elsewhere. So it brings up another good question as to how do we prevent the spread of the coronavirus? And really, the great news here is that just like any virus, we have to go back to the basics. So the message we've been trying to carry forward, as did President Obama, is keep calm and wash your hands, right? Because these viruses, the only way to contain these viruses is really a lot of hand hygiene. So anytime you're touching surfaces, it can be spread by contact, it can be spread by people coughing as well. So really important to do frequent hand washing to prevent passing this on. The one other piece that I wanted to touch on was our coronavirus here at Rush. So we have had, today is, I got to get my dates together, I've been here an awful lot. So March 7th, on Saturday, March 7th, we've had a single 1 case of coronavirus to date. There's been a number of patients that have come in that we screen as they come into the hospital, and we've said, boy, this is a good enough story that we think we need to evaluate you to see is this the flu, which is far more likely the case. About 29 million people in America this year have had the flu, so far more likely to be flu, or could this be the coronavirus? So we've had about 10 or so patients come through that we did that evaluation. In that evaluation, only 1 patient to date has actually had the coronavirus. That patient was seen in the emergency department. As I said, like most patients, he looked incredibly well just with cold symptoms. We tested him. He was actually sent home for that self-quarantine. Came back later that night saying he was starting to not feel as well, so out of an abundance of caution, we put him up in our medical isolation room upstairs on the 10th floor and watched him up there for about a day or so. Throughout the entire time, I can tell you he was completely stable. He was sitting up, texting with family, texting on social media, again, just with these cold symptoms. So we really played it just on the safe side, as this was one of the first patients to come in. I think all indicators are that we're going to see more cases likely in the Chicago area. The best things, again, we can do is really the hand washing, that self-isolation, trying to, if you're having any symptoms, this isn't a time to come to work if you're having a fever at home. And the final thing I'd like to say is that we have set up a number of resources. Most importantly, we have our rush.edu coronavirus page, and that we are keeping up to date with both the latest resources as well as questions. Any questions that have come up, we're trying to keep that page updated. So hopefully that caught you up with some of the information around the coronavirus, and we'll try to keep the communication going as much as we can. Hi, I just wanted to provide a quick update on coronavirus and where we stand now, about a week since the last update. So we are seeing more cases, as you've seen, both throughout the world, throughout the United States, throughout Illinois, as well as locally here at Rush. And that we expect to continue as other countries have experienced the same. The most important piece of this is keeping in mind that the vast majority of people that develop symptoms have incredibly mild symptoms. Over 95% of patients will just have fever, cough, upper respiratory congestion, sore throat, really similar to the flu. Now, those that are at risk for developing more severe disease from what we've seen across the globe are those that have other medical comorbidities and those that are 60 and above. So that's diabetes, hypertension, heart disease, things like that. Really got to be careful in those cases if you have the influenza-like symptoms, the fever, cough, and shortness of breath. That's the group that we're a little more concerned about and we want coming into the hospital for evaluation. But what are the things that we can do to try to prevent the spread of the coronavirus? And really harks back to the simple things again. I've also tried, like many others I'm sure, to go buy some hand sanitizer, and things like that are in really short supply, including toilet paper, which I don't understand as much. The good news is soap and water is just as effective. So really when you're using soap and water, if you don't have hand sanitizer, it's 30 seconds, singing yourself happy birthday twice, really creating a good friction, getting your hands. That's just as effective as the different alcohol-based hand sanitizers. Also make sure for those with kids, I have 3 little boys, make sure for those with kids, you're telling them to frequently wash their hands. Because while fortunately kids don't seem to be necessarily as symptomatic or end up needing hospitalization as much as the elderly in this case, it's really important that they're washing their hands because they're incredibly effective at passing on germs from outside and passing them on to surfaces and that around the house. So again, washing the hands probably the most important things we can do. The other piece is, what should I do if I think I'm having symptoms of coronavirus? So if you are experiencing fever, cough, shortness of breath, those are times that certainly we want to provide every option for you. Understandably, a lot of patients are concerned about coming into the hospital at times like this. So video visits are a great option. We've set up a platform on our rush.edu to allow you to do video visits directly from there and kind of assess your risk for coronavirus. I would say for those that don't have symptoms, testing is not recommended for that group. So it doesn't make sense necessarily if you're not having any symptoms to know whether you have coronavirus or not. Doesn't really make a whole lot of difference in that case. So it gets back to the simple things again: social distancing, hand washing, and by social distancing we talk about not being around in large crowds, especially trying to avoid those that are coughing a lot, trying to keep about 6 feet apart when possible on public transportation, things like that. Again, as possible. It's not to say necessarily need to do that in every circumstance or avoid using those means if you're not able to keep that distance. But really, these are the things that are most effective at containing this virus and letting the virus pass over as it has in other parts of the world at this point. I think here at Rush, we're uniquely prepared in our ability to take care of patients that are sick and seeking care, not just from the perspective of facilities, but more importantly, from the perspective of our care teams here. So please remember, be safe, wash your hands, and again, we'll all get through this together.